everybody have their task analysis sheet? So when you get your requisition, you know, you're going to look over it real quickly. You're going to look to see what the exam is, and in our case right now it's going to be skull. We want to make sure that our room is set up. We want to have a 40-inch SID. We want to make sure that we wipe this down. Of course, we want to make sure that when we bring the patient in that nobody's come in between us and put somebody up there for a chest or something. So like I said earlier, you can wipe it down again for the exam. So we want a 10 by 12 cassette, and we're going to put it in lengthwise. The only one we're going to put it in transverse is which? Lateral. Good. So we're going to ask the appropriate questions, and women of childbearing age, what are we supposed to ask them?
Any chance they could be pregnant.
Okay, and how are we supposed to get our patients dressed for the exam?
No metal from the neck up.
Metal, dentures, glasses, earrings, of course.
No bones.
No what? Yep, braids, anything, hair pieces, necklaces, gum. That's good. It's true. You know, nose rings, anything. So it needs to remove basically from the neck up. All right. So do you have to put a gown on your patient?
No,
Not necessarily. Correct. No. Good. All right. So who's the patient? All right. You don't have to. You can leave it up. We'll just simulate. Okay, so your patient's going to face the board because we're going to do a PA Caldwell first. So this is for skull work. Since we're doing it upright, what is this going to demonstrate besides the piece of anatomy? Any ear lobes. Right, it's going to show the frontal sinuses. For sinuses, you know, you want it definitely upright. So what does it say on your sheet? You want to have the OML perpendicular to the image receptor. You want to have the central ray exiting at the nasion, correct?
Mm-hmm.
How much of an angulation? It actually depends on your facility. Anywhere from 15 to 23 degrees is usually what they do. And which way are we angling?
Caudal.
We are angling caudally. Okay, ma'am, I'd like you to tuck your chin down, and I'd like you to put this piece of your nose right there on that X. And that's all you have to do is have them tuck their chin down. You want to use their OML, have that perpendicular to your image receptor. And if you have a pen or a tongue depressor, you can actually use that to make sure that you're perpendicular. And that looks pretty good. And we're going to exit where? Nasion. Now, if we didn't have any angulation on the tube and we exited a little bit higher at the glabella, what would that be?
PA.
Just a PA, correct. And what did I tell you you were going to see on a PA versus a Caldwell? The Petrus ridges. So with a PA 0 degrees, the Petrus ridges are going to fill the orbits. With angulation, the more you angle, the further down below that lower rim of the orbits are going to be. With a 15 degree, they're about in the lower thirds. Of course, you also want to make sure that you shield, correct? I can get this. You okay, ma'am? Good. Yeah, it is. The important thing, you want to make sure, a lot of times when people, especially patients that are compromised or just tired, not feeling good, they're going to close their eyes. And what happens when you close your eyes? You kind of get dizzy, and that's what she was just doing. She was closing her eyes. So you want to tell them, go ahead and keep your eyes open. Are you okay? Mm-hmm. All right. You want to make sure you check on your patient. Now you can see we're off just a little bit. We want our central ray to go where? Down the mid-sagittal plane, correct? So I'm going to move you over just a hair, ma'am. Okay. Make sure you're nice and straight. OML is still perpendicular. We want to make sure that we include what? The vertex. And we can see pretty well the shadow of the skull. Now sometimes if you have somebody with a longer skull, we may have to center up just a little bit higher. She's got a pretty small skull, so I think we would be good. Where is our marker going to be? You can have it anywhere you want, but not in the anatomy. You want it on the correct side? Correct? Everybody got that?
Right.
What is our breathing instructions? Just hold real still. Don't breathe. Don't move. Go make your exposure. Bring your next cassette out. Okay? Go ahead and relax.
about the
And-
bucky?
You gotta make sure that that's lined up. You wanna make sure that they're both lined up. Okay? Any questions? All right. Everybody good with that? Easy, that one is. Okay, so what's next? What's on your list?